body is like a treasure chest, and you have to find it. Heather Balk, OBGYN sonographer, Sanford Medical Center. I selected Mrs. Balk as my interviewee because she was my OBGYN sonographer during my pregnancy. She is in the profession I wish to soon be in, and also a friend of a relative. So setting up an interview was an easy and comfortable communicating experience. This previous familiarity with Mrs. Balk made asking questions have fluidity and ease. So what is sonography? Mrs. Balk explained that sonography is the use of sound waves to view images of internal organs. How does this work? There is a handheld device called a transducer that a sonographer will use to send high-frequency sound waves through your skin that will bounce off of objects, which could be an organ, soft tissues, or a baby, and it will create an echo. And the transducers has a microphone that records its echo that are made, and then they're sent to a computer, and that creates a black and white image, and that's how you see everything. This is a vital tool for healthcare workers to provide treatment to its patients. One of the ways it is used is in pregnancy, and which is the most common reason when people think of ultrasound, they think of a pregnant woman seeing their baby for the first time. And this is what I hope to be when I finish college, is an OBGYN sonographer. The person that introduces their child to their parents and provides excellent care and compassion through the most exciting journey of their life. Mrs. Balk and I had a long conversation for about an hour, talking to her about her career, and it was a gratifying experience to listen to the 10-plus years of learning she has had in the sonography world. And she gave me a glimpse of what it will take for me to be, as she puts it, the eyes of the doctor. A heavy task, right? Precisely. She stated that there are 3 very important things her job entails every day. 1, competency. 2, communication. And 3, compassion. This is what I will be focusing on for today for you. From the formal education to the direct communication with the doctors weighs a heavy duty of understanding exactly what you are doing and being able to communicate to the doctors professionally and competently. But before you can be the eyes of the doctor, you first have to complete a certification or associate's program, pass a board certification test, and follow up with training every year to remain in the expertise of sonography. Competence and an expertise of your field is the first thing Mrs. Balk mentions as one of the 3 main job duties. She described that the importance of competence is vital to providing the best health care that your patient needs. If you don't get your images, the doctor can't see inside the body. And this could mean missing or overseeing a medical issue that needs discovery, resulting in a failure in providing good health care. Secondly, closely intertwined with competency is communication. Through your images, having accurate pictures taken of the organs or baby, then providing the results to the doctor is very important trust relationship. She stated, communication is everything. Although there is no formal training of good oral communication, one must study, there is no formal communication of one must study. This is learned and achieved by your own personal communication techniques. But the communication of what your images show and prove is studied, and you want your images to be sound and capture what the doctor is looking for. Your images tells the doctor what it is or isn't. But also, you need to be able to communicate professionally with knowledge to connect with the doctor on what you saw. It is your job to do your job right, so the doctor can do their job right. And that's where good health care is shaped. Another important form of communication she mentions is nonverbal communication. A sonographer views and captures what the doctor needs to determine a health care plan. You see these images first and with the patient. And you must have a poker face, as Mrs. Balk called it. You're going to see things you cannot reveal what you saw to that patient. It isn't your job to determine a diagnosis. It is the doctor's. So you must not cause any anxiety or make a patient nervous by facial expressions. Remaining in control of your body, your language, and your facial expressions is very important in this job. Lastly, she mentions compassion, explaining to me that in the healthcare field, you are dealing with people's lives and health, people of all ages, across many different demographics. There will be language barriers, so compassion is communication within itself, and that connects you with your patient, and it is a universal language everyone must receive. She goes on to emphasize that this is a real life job that affects real life people that can potentially change the rest of their lives. So taking the time to really focus all your attention on each and every body that walks through that door. Achieving and giving the best possible care and compassion is the most important job you can do, and a great service of the human heart. For me, this has been the best assignment I've ever had. I got to listen and walk through Mrs. Bulk's everyday job and really capture in my mind what exactly is required of a sonographer. Competency, communication, and compassion. I am going to take this information and focus my attention on being the most informed in the studies of OBGYN sonography. I want to know all that there is to know and understand the ins and the outs of it. I want to polish my oral communication and become a better, more effective communicator. Know what I'm talking about and create that trust relationship that is so vital to have with a doctor. I have learned that this is going to take a lot of hard work to get there, and the days on the job won't always be easy. But with all the doctors and staff working towards the same goal, which is healthcare that matters and makes a difference for the patient, it will all be worth it. There is one cause of action, and that's the patient. And that's who I want to work for. No, not off. Not off yet, right? Huh? I just have to show the audience again.